Good morning to everyone. Today's topic is maxillary injection techniques of local anesthetic injections. Local anesthetics are drugs that are used to prevent or relieve pain in specific region of body without loss of consciousness. They act by reversibly blocking nerve conductions. Now coming to the maxillary injection techniques, we'll discuss one by one. First of all, supraperiosteal injection, which is also known as infiltration technique. In this technique, the nerves anesthetized are large terminal branches of dental plexus. Areas anesthetized includes pulp and root area of the tooth, buccal periodontium, connective tissue, and mucous membrane into which the local anesthetic solution is administered. Landmarks of supraperiosteal injections are mucobuccal fold, crown of the tooth, and root contour of the tooth. Target area is apical region of the tooth to be anesthetized, and then the needle is inserted into the height of mucobuccal fold above the apex of the tooth being anesthetized, and approximately 0.6 to 1 ml of solution should be administered. Then the posterior superior alveolar nerve block. In this, the nerves anesthetized are posterior superior alveolar nerves and their branches. Areas anesthetized are pulps of maxillary second, third, and first molars in 72% of cases, and in 28% of cases, the first molars gets anesthetized by middle superior alveolar nerve block. And buccal periodontium and bone overlying this tooth also gets anesthetized by posterior superior alveolar nerve block. Landmarks of posterior superior alveolar nerve block are mucobuccal fold, maxillary tuberosity, zygomatic process of maxilla. Then the target area is the posterior superior alveolar nerve, which lies posterior, superior, and medial to the posterior border of the maxilla. The area of insertion is height of mucobuccal fold above the maxillary second molar, and here approximately 0.9 to 1.8 ml solution should be administered. Then middle superior alveolar nerve block. The nerves anesthetized are middle superior alveolar nerve and the terminal branches. Areas anesthetized are pulps of maxillary first and second premolars and mesiobuccal root of first molar in 28% of cases, and buccal periodontal tissues and bone overlying this same tooth. Landmarks are mucobuccal fold above the maxillary second premolar. Target area is maxillary bone above the apex of maxillary second premolar, and the area of insertion is height of mucobuccal fold above the maxillary second premolar, and approximately 0.6 to 1.2 ml of solution should be deposited here. Then anterior superior alveolar nerve block, also known as infraorbital nerve block. The nerves anesthetized in this block are anterior superior alveolar nerve, middle superior alveolar nerve, and infraorbital nerve. Areas anesthetized are pulps of maxillary central incisor through the canine on the injector side, and in about 72% of patients, pulps of the maxillary premolars and mesiobuccal root of the first molar, and buccal periodontium and bone of this same teeth, and lower eyelid, lateral aspect of nose, and upper lip region. Landmarks are mucobuccal fold, infraorbital notch, and infraorbital foramen. The target area of infraorbital block is infraorbital foramen, which lies below the infraorbital notch. Area of insertion is height of mucobuccal fold directly over the first premolar region. Then greater palatine nerve block. In this, the greater palatine nerve gets anesthetized. Areas anesthetized are the posterior portion of the hard palate and its overlying soft tissues anteriorly as far as the first premolar and medially to the midline. Landmarks are greater palatine foramen and junction of the maxillary alveolar process and palatine bone. Target area is greater palatine nerve, which passes anteriorly between the soft tissues and bone of the hard palate. Area of insertion is soft tissue slightly anterior to the greater palatine foramen. Nasopalatine nerve block. Nerves anesthetized are nasopalatine nerves bilaterally, and areas anesthetized are anterior portion of the hard palate bilaterally from the mesial aspect of the right first premolar to the mesial aspect of the left first premolar. Landmarks are central incisors and incisopapilla. And target area for greater palatine foramen nerve block is incisive foramen, and beneath the incisive papilla, an area of insertion is palatal mucosa just lateral to incisive papilla. Then maxillary nerve block. Nerves anesthetized are maxillary division of trigeminal nerve. Areas anesthetized are pulpal anesthesia of the maxillary teeth, buccal periodontium and bone overlying these teeth, soft tissues and bone of the hard palate, and part of the soft palate medial to the midline. Target area is maxillary nerve which passes through the pterygopalatine fossa and superior and medial to the target area of the posterior superior alveolar nerve block. In this there are two approaches. First is high tuberosity approach. Area of insertion for high tuberosity approach is height of mucobuccal fold above the distal aspect of the maxillary second molar. Landmarks are mucobuccal fold at the distal aspect of the maxillary second molar, maxillary tuberosity, and zygomatic process of the maxilla. And in greater palatine canal approach, area of insertion is palatal soft tissue directly over the greater palatine foramen, and landmark is greater palatine foramen and junction of the maxillary alveolar process and palatine bone. In both these approaches, the 30 mm of needle should be inserted inside the tissue and approximately 3 ml of solution should be deposited. Thank you.